right. Welcome to Thursday's Team Kentucky Update. Before we get started, our flags are flying at half-staff today in honor of two of our state legislators that we lost this month. Senator Tom Buford of Nicholasville passed away a couple weeks ago, and State Representative Bam Carney passed away this last Saturday. His funeral is today. We honor them for their commitment of their time and their talents in trying to make a difference in the lives of our Kentucky families through their service in the legislature. Our prayers are with their families. Now, oftentimes in Frankfort, we think about the loss of a state representative or a senator and what we see up here. But let's remember they are parents and grandparents. They have a community, friends, and family that will be missing them. We want to be there with them in their time of grief, and everyone seeing the flags flying again at half-staff at the Capitol today should not only know why, but should send their own support to those individual families. All right. Once again, we're going to lead off our Team Kentucky update with an economy that is truly on fire. Kentucky's economy is surging, and the end is not in sight. As we move into the second half of 2021, we are positioning the Commonwealth for long-term growth. And I believe we have moved past just believing we're on the precipice of an age of prosperity, and we are more and more certain that we are walking into better and better times. This week alone, the first 3 days of this week, I was able to announce 1,100 new jobs here in Kentucky. On Monday, I was proud to join GE Appliances to celebrate the completion of a 245-plus job expansion in Building 5 in Louisville's Appliance Park. Originally announced last summer, this $60 million investment introduces the company's production of high-end four-door refrigerators to the U.S., something that before recently this group and others in America did not think they could compete on and in manufacturing these in America. So we are proud that here in Kentucky, that GE Appliances is able to take this step, and it shows that American manufacturing is not only strong, but that we are going to see a resurgence. This project signifies GE Appliances' domestic conversion to next-generation refrigerants to provide consumers with more environmentally friendly options by reducing greenhouse gas emissions. GE Appliances' impact on Greater Louisville cannot be overstated. As somebody who lived in that city for 15 years, we saw GE shrink and shrink, and now we see GE Appliances grow and grow. Currently, the company employs more than 7,000 people at the Louisville operation, and I am thrilled to see its presence continue to grow. This is a really good sign for a number of reasons. Also this week, we celebrated the opening of Dollar General's 300-job distribution center in northern Kentucky's community of Walton. This is another company with deep roots in our state, as Dollar General started in Kentucky. It was founded in Scottsville over 80 years ago, where it continues to operate a distribution center today. Dollar General has since grown from one retail store in Springfield, very first store in 1955, to more than 17,000 stores across the country, but they open one so frequently, I'm sure that's grown since we started this press conference. Our state's key location was a major selling point in securing the $65 million expansion, and later this year, we are going to be able to open another facility here in Kentucky with a significant number of jobs. Kentucky sits within a one-day drive of two-thirds of the United States population, an important factor for a company serving over 800 retail stores. With this creation of 250 distribution jobs and 50 private fleet jobs, Dollar General is furthering its long-standing partnership with Kentucky and helping to create a brighter future for our residents. It's a neat one to be a part of. A lot of culture building that you see in this company. A lot of really positive work environment where we saw people of all ages and from all backgrounds there ready to work and excited about it. Finally, on Wednesday, I was able to announce one of the largest job additions in the Commonwealth since I became governor. As we announced, Fidelity Investment is creating more than 600 new full-time jobs at its regional office in Covington. Most of these positions will not require previous financial services experience, creating a wealth of opportunity for people. What Kevin here, Canifax, talked about is they're looking to get good people in the door, and then they're going to help them get the licenses they need, making this an opportunity not just to get a good job right out of the gate, but to grow with the company and to grow your career. The most recent hiring spree adds hundreds more hires since the beginning of 2020, and it will mark Fidelity's largest workforce in Kentucky ever, with more than 5,000 jobs. As a top employer in the region, Fidelity has increased its workforce tenfold since it first came to Kentucky in just 1992. In addition to providing hundreds of Kentuckians with high-quality careers, the company's values align with Team Kentucky, with our values here in the Commonwealth. A lot of what people do at Fidelity is talk to investors, is help to ensure that they're making the right decisions and they get their questions answered. And listen, we do hospitality better here in the Commonwealth than anywhere across America. So I believe it's no coincidence that Fidelity chooses Kentucky and Covington to be the heart and soul of its customer service experience. Fidelity also believes, as I do, in creating avenues for people to advance their lives, that a job should be a pathway to a career, and that's what they're offering to these new employees. This is a great opportunity for Kentuckians, and I urge those interested to visit jobs.fidelity.com to apply. The company is investing in Kentucky, and we're going to make sure that that is a good investment. So I want to thank the leaders of all three of these companies, GE Appliances, Dollar General, and Fidelity Investments, for making this a heck of a week for the Commonwealth of Kentucky. But this is just building on work that we have already done. We've now announced 60 new locations or expansions this year, more than $2.2 billion of new investment, and more than 5,000 new jobs just in the middle of July. As a comparison, we announced 4,000 new jobs all of last year, and that ranked number one in our region in economic development. This has been a great week, but our best days lie ahead. We believe next week we're going to have an announcement that's going to knock everybody's socks off, that's going to be one of the largest in Western Kentucky in decades, and we believe that there are even more to come. All right, if we are building that better Kentucky, if we are going to serve all of these new job opportunities, we must have the infrastructure to do so. So today we're giving an update on our Better Kentucky plan, and that is the clean water and broadband that we are able to ultimately lift up based on that bipartisan agreement we were able to reach with the state legislature on the American Rescue Plan Act dollars. That bipartisan agreement is going to create 14,500 new jobs across Kentucky. And it was a good opportunity to see that we can still come together and remember that a good job isn't red or blue or Democrat or Republican. It's just really good for our families. So let's start with an update on the three parts. Remember, we had schools, broadband, and sewer and water. So let's start with better schools because we had an important announcement over this last week. Yesterday, we announced that the Kentucky School Facilities Construction Commission is now accepting applications for $75 million in grants for vocational school upgrades. This was included in the last budget. Remember, there's $127 million that went into the regular school construction fund that's going to help us help more of our K through 12 schools that are in disrepair. This is a separate pot of money, competitively awarded to vocational schools across Kentucky to help us build up our workforce. Local area vocational educational centers that are district-operated career and technical education centers that included in the district's facility plans are eligible to apply for up to $10 million per each project. So there's $75 million total. Each project can apply for up to $10 million in funding to cover the cost of renovations, which include updating, expanding, repairing, replacing, or rebuilding a structure. And if we think about this, some of these schools have been in operation a long time, and the needs of our economy have changed at different points during that. This gives a chance, if we were a company, to say to retool. This is going to give our schools that same competitive advantage. Each district may receive no more than one funding award. Applicants will be scored on the following criteria: age of current vocational educational facility, financial need, enrollment in job creation and training programs as a percentage of total district enrollment, unemployment rate by county as of May 2021, and quality of the planning and district facility plan. Applications will be accepted through 4:30 p.m. Eastern Time on Friday, August 13th, and can be emailed, and the applications were emailed directly to qualifying schools. We're going to announce the funding on September the 1st. All right, so that is schools. Remember, we already announced the schools qualifying for the $127 million. Now we've been able to put out the application for the $70+ million in vocational. The next chunk is the clean drinking water, water and sewer. On Tuesday, we announced the first recipient of those funds from the Better Kentucky Plan. It's $250 million Cleaner Water Program. Thanks to unanimous support from local officials and from them working together, we had multiple mayors, county judge, state senator, state representative, and the Water Commission. And with help from KIPTA, the Area Development District, Shelbyville Municipal Water Commission was awarded just over $1.8 million to construct a 36-inch gravity sewer main to the new Shelbyville wastewater treatment plant. Thanks to this project, it's actually 3 pumping stations, we learned that day, are going to be able to be eliminated. These are pumping stations that were beyond their time, and these upgrades will encourage further economic development in this community and prevent sanitary sewer overflows, which are unfortunately common in the area. So, as an idea, remember, this is $250 million, and we're going to be talking to the legislature coming up about what else we need to do. So here's what we have received and what it would total. We've received 348 funding requests from this program, representing 87 counties, that total $594 million. So that gives you an idea of how much demand there is out there and the discussions we're going to need to have with the legislature, which is very open to them, about what comes next. We look forward to the next funding awards. I believe the next one's coming in around the next week, as we know they will help transform our communities. All right, final piece. Remember, schools, water and sewer, and then broadband internet. Finally, better internet. So on June 24th, we announced the RFI, the request for information we put out. And all this is making sure that we get the most accurate information and information from all sources about what areas of Kentucky are truly unserved, do not have broadband access, and unserved actually has a federal definition of a speed. If you are below it, they consider you unserved. The RFI asked broadband providers to submit ideas, suggestions, and comments as we develop the process for distributing this pot of money is $300 million to improve access across the Commonwealth. More than 24 interested parties responded to the RFI. Their input's going to help us develop the formal RFP, request for proposal, which is going to be released later this summer. And that's going to be a really big step in the process. So we've gone from, if you remember, our mapping, which we had to put together from all the various sources, to the RFI. RFP is coming here really soon, and then there will be awards that move forward from that. This is our opportunity to build on economic momentum and to ensure we have the infrastructure of the present and of the future we need. We've already seen great progress. And again, better schools, cleaner water, and better internet are better for all of our people. All right, on the ARPA fund, we also have one other big announcement today, and that's about our local governments. They have been such an important partner in our battle against COVID-19. We know they've taken on great expenses and suffered great hardships, and they've provided phenomenal leadership. So I'm excited to announce that more than $157 million is coming to more than 360 city governments from the American Rescue Plan Act as soon as next week. These are the dollars that were included in the act for localities. They actually, for cities, flow through us, and that will be going out to those cities next week. The Department for Local Government was tasked with getting budget certification forms from our non-entitlement cities. Remember, there are a couple cities that get it directly. Those are your Louisvilles, your Lexingtons, and a few more. Or cities with populations under 50,000 and did not file for a different status with HUD. That's how you are an entitlement or a non-entitlement. DLG has processed payments through the state accounting system and plans to mail the checks today. So to all our cities out there, checks in the mail. It's coming to you, and I know it's going to help you, whether it's with your budgets, expenses from COVID, and whether it's with water and sewer that you want to team with us. The dollars are on the way. These are great news for these cities, and it's going to help make sure that each and every one of them can be a part of this economic explosion that we are seeing. And that's really important. We've talked about it a couple times, but I think we have a great responsibility with this moment in time that we're sitting at. And that's that the prosperity that I believe we're going to see needs to reach every part of Kentucky and every part of each one of our cities. This is a chance to get this historic moment right, and we're committed to do everything we can to do so. All right, as another update, let's talk about Kentucky State University quickly, and then we can take questions afterwards on it. My administration is always going to put education first, and that means doing what's necessary to ensure that we have continued stability, success, and growth in our state's colleges and universities. It's what our students and our faculties and staff and taxpayers deserve. It's why on Tuesday I requested a full, independent, and transparent accounting of Kentucky State University's finances. I also signed an executive order to ensure the Kentucky Council on Post-Secondary Education is empowered to be a part of this, to provide guidance, to have oversight, and to have access to the information. I want to make sure that we say that this administration believes in KSU. It being our only public, historically black college here in the Commonwealth is so critical, both to our past, our present, but also our future. And I'm committed to making sure that we can get KSU on the right track. Before we can get there, we have to know everything that is on the wrong track. And the people of Kentucky deserve to know every single bit of it too. But my commitment is to do everything as governor and to bring what we need to bear to make sure we resolve what appear to be years, decades of concerns and or problems, and make sure we can get moving on the right track once and for all. But I believe in KSU. And so we are going to work to get through this time. We are going to work to get back on track. But my commitment is to be transparent once this audit is done so that everybody can see any of the concerns that are out there. Update on COVID. So based on the rise of the Delta variant, Dr. Stack and I updated Kentuckians on Monday. We're likely to do so this coming Monday as well. Dr. Stack's going to provide a few words here today and is going to be available for questions. Let's be clear about the Delta variant. It is the most aggressive form of COVID that we have seen. If you are unvaccinated, it is the deadliest form of COVID that we have seen. And again, to use the words of the FDA Commissioner Scott Gottlieb under President Donald Trump, if you are not vaccinated and you have not already had COVID, expect to get the Delta variant and expect it will make you the sickest that you will ever be in your lifetime. Those are his words, that expert. And that should encourage every single Kentuckian who is eligible that has not gotten vaccinated to get out there and get vaccinated. We talked on Monday about how it is concerning, and on Tuesday, we had 1,054 new COVID-19 cases, the highest since March 11th. On Wednesday, an additional 963 cases. We do have an update that we can provide you on the percentage of the sequencing we do that's the Delta variant. I believe it's now 28 or so percent, but listen, it's almost all of them. Dr. Walensky from the CDC believes over 80% of all cases right now are the Delta variant. So do we. So do we. When you look at how quickly the numbers are going up, I believe that it shows that this is what we're dealing with, and it's what everybody in America is dealing with. Because of that, we made some recommendations on Monday. I want to make sure that we share again. First, all unvaccinated Kentuckians should wear masks indoors when not in their home. If you're unvaccinated, This is the deadliest form of COVID. Remember, it's already killed 7,200 people, and this is a deadlier form that we have ever seen. I would mention that if you are vaccinated, and we'll talk a little bit about breakthrough cases, it is still providing some pretty significant protection for you. Number 2, Kentuckians at higher risk due to pre-existing conditions should wear masks indoors when not in their home. If you have a breakthrough case and you are more likely to have a worse result because of pre-existing conditions, you really ought to consider that mask. Third, vaccinated Kentuckians in jobs with significant public exposure should consider wearing a mask at work. Next, if you are unvaccinated, go get your shot right now. It's serious. It's really serious. And it is impacting younger folks. Can we show, just today, we see more stories than we have in the past about young people not only getting COVID. Remember, that's what we used to talk about, young people getting COVID. Now it's having very serious results from it. More individuals being intubated, more individuals going into the ICU at younger ages. Folks, we're sounding the alarm, and all the information is out there. Please go get your shot. We did something the last time where we walked through age groups and showed percentages vaccinated. We're going to do that again. First, this is a little bit of good news. Since Monday, we've ticked up 1% in total Kentuckians 18 years and older vaccinated. We're now up to 62% from 61%. Next two have stayed the same, but they're ones that we are proud of, 65 and up. We have it at 83% in the state. The CDC records us at 86%. I suggest you pick the better number. 50 to 64, 65%. Again, we want to continue to increase this. 40 to 49, we ticked up 1%. This was the group that helped us overall, but we still need to get this number significantly up. And then the next three categories, 12 to 39, is where we need to see significant improvement. Remember, this means you are a younger Kentuckian, and the Delta virus is causing worse results, more intubations, and will ultimately cause more deaths in younger Kentuckians. This is you. We need you to go get the shot. It's just over a third of 18 to 29-year-olds. 1/3 in Kentucky are vaccinated. We need you to go out and get that shot. And remember, if you do, you can win $1 million. So if the concern about the Delta variant isn't enough, how about the possibility of being our next millionaire? Everybody 18 and up can qualify for this, and we have 2 more drawings next week on July the 29th and then on August the 26th. That is 2 more millionaires in the Commonwealth of Kentucky. And if you were 12 to 17, you need to get this vaccine. You need to get it because of the upcoming school year. We're going to be in continued conversations with the KDE about what that may look like. But the number one thing you can do to protect yourself going in to that school year, to make sure you don't have disruptions, is to get vaccinated, and you can also win a free higher education. That's one of your choosing, to any public university, to any public community and technical college, to any certificate program. We're going to have 10 more kids win those scholarships. So far, more than 697,000 Kentuckians have signed up for the $1 million drawing. More than 39,000 students have. More than 214,000 of those adults and 7,000 of the students signed up after we announced our first winners. I will also say that while it's always going to be hard to know what if, we do believe that this drawing is working, at least to some degree. The last month, the weeks in June, we were about 109,000, 110,000 vaccinations. We appear that we're going to hold steady this month with at least around the same amount. We would think that we would drop off each month as the populations become harder to reach. In the very least, I think that we have gotten to a point where we are steady. Of course, I really want more people to get vaccinated. So please, get your vaccine, go online, sign up. This is the way that we defeat COVID-19. Let's look at our stair-stepper chart, which we will have final on Monday on cases. And once that comes up, as you can see, we are now in a multi-week increase. And as we sit here on Thursday, we should expect for this next week's full number to exceed last week. We believe at this point that we are going to be on Monday in another week of increasing cases. Let's look at vaccination status of COVID-19 cases, hospitalization, and deaths. Now I want to say final numbers, which we will send to you, they only become really final at month's end. That's because sometimes the information we get changes when it's as of yesterday or the day before. Sometimes they're probable cases. And so the numbers that we'll share today are through July 21st, but they're subject to change a bit. They're about 1% off of the numbers from the end of June that we can send you that are final. Do we have that chart? What they show is from March 1 to July 21st. All right, this is about the time when a whole lot of people had the opportunity to be vaccinated. 95% of all positive cases were among unvaccinated individuals. That is an enormous statistic. 95. Hospitalizations, 91% of all amongst unvaccinated. And in deaths, and I do want to give a little nuance on this, 88% of all deaths among unvaccinated individuals. Now when you look, thank God, our number of deaths, while 50 is concerning, we never want to lose 50 Kentuckians from that period of time, is significantly lower than we had in previous times. It is a smaller sample size than just about any time going back until mid last year, and that's a blessing. So, you know, that statistic again, we believe shows that these vaccines significantly decrease the possibility of death from COVID. It is a small sample size. We want to make sure we are transparent about that. Just to give you an idea, if you request the final numbers we can provide, which is through the end of June, the numbers are very similar. It's 96.6% of cases. That may suggest the Delta variant breaks through a little bit more because that ticks off about 1%. 92% of hospitalizations unvaccinated, and 89.5% of deaths. We were asked last week, we were asked Monday about red county recommendations. So Dr. Stack is here today to run through what our current recommendations are for counties that would enter the red zone. Steve?
James, leave that up for a second. Thank you, Governor. Sure. Good afternoon, everyone. And just using this slide before I go to the red county guidance, there's 61,292 individuals in this. I like this kind of data set more than the smaller data sets. This is very robust, all right? There's a lot of people involved here over a longer period of time. I have more confidence that what we're giving you is representative of our journey over those months. When we get to really close time frames, the most recent week or 2 weeks, and there's small numbers, I just want to continue to disclaim the data will change. The numbers in some of the tables will change over time, and my commitment has been all along, our team's commitment, as we learn more, we will update the data and we'll tell you why it's updated and changed as we report these things. So,
Steve, I misspoke on deaths. Will you fix that? We had 447 total deaths, 50 and 397.
correct. So the governor's saying is we had 447 total deaths from March 1st until July 21st that we've reported, 50 vaccinated and 397 unvaccinated. And let me point out, when you have only 50 deaths in the vaccinated group, if you have a small number of those individuals, say they had cancer diagnoses on chemotherapy or they had immune compromised conditions, that small of a sample size could have very legitimate reasons why even despite being vaccinated, they had a worse outcome. So again, just offering that. I like this kind of size of data better than the really small sample sizes. James, could we go to my slide deck, please? Real fast. I like to show this. This is, I think, the better way to show that table that we just shared. This takes vaccinated population in the gray bars, unvaccinated in the gray bars, vaccinated in the blue bars. So now what we're doing is saying for everybody we know who tested positive, which ones were unvaccinated, and for all the positives, which ones were vaccinated. Now we can compare the relative risk between the two populations. This is a better way to look at this data. So on the left in March, 4.2 time higher risk if you were unvaccinated that you would get infected. 4.8 times in April, 7.9x in May, 6.4x in June, and 5.3x in July. So again, the data will bounce around a bit, and the July is very recent. I know that when I tell you cases through yesterday, that data is going to change because we're going to get reporting ongoing and revise those numbers. But if you look, the number of cases is clearly going up, but it's going up predominantly in the unvaccinated, and proportionally the protection is staying very robust so far. So I hope that's reassuring. Vaccines work, folks. We should all get vaccinated. Next slide, please. The governor's already gone through this. I just wanted to provide it one more time. This remains our recommendation for folks who should wear masks now, who should really seriously consider wearing masks. And since the governor went line by line through it, I won't repeat it right now. If we could go to the next slide, James. This is what we're going to recommend for the red counties. Now, I'm going to make a few points on this. Vaccines work, like I just said. It is absolutely essential we all choose to get vaccinated. It's our choice, but choices have consequences, and what I showed on the bar graph slide is the consequences: you're more likely to get sick. And let me put this in context. Our positivity rate's going up. It's getting closer to 7. That's a big leap from 1.6 or 1.7% where we bottomed out just a couple months ago. The hospitalizations are increasing, but they're not increasing at the same rate as they did last year. That's vaccines. Vaccines are helping, and like the governor said, 83 to 86%, depending on which data set we use, of our population 65 and older are vaccinated. That's fantastic because 91% of all of our deaths occurred in people over 60. So hopefully what will happen is, even as the cases go up, the hospitals will continue to have capacity to care for everyone with COVID, but also to care for all the heart attacks and the strokes and the folks with a gallbladder problem, appendix, and all the other things. We need to make sure we preserve health capacity. And right now we're in good shape, but we're watching it very closely. And I spoke with all the hospitals, the CEOs and chief medical officers this past Tuesday. We're in ongoing conversation, and I just want you to be reassured the community across the state is looking out for Kentucky and working with the governor and his team for us to try to make sure we're prepared. Please encourage masking as an effective way to reduce the spread of disease. Again, people ask about mandates. We're encouraging you to please do this. If you're unvaccinated, you should follow the guidance on the previous slide. You should wear a mask when you're out in public. If you have a compromised immune system or you're medically frail, you should wear a mask, even if you're vaccinated, because your immune system may not respond as well. If other people, for whatever reason, have concern, they themselves are concerned, they're worried about a family member at home, because you can still get infected and have no symptoms, even if you're vaccinated, and they want to wear a mask, please be supportive of them, at least be tolerant to them. Please don't judge other folks for choosing to wear a mask. We know it's helped, we know it's worked. It eliminated most of these diseases in kids last year, and so the common cold and pink eye and all sorts of other infections effectively in the flu disappeared, and that's because they wore masks and people physically distanced. It really worked. Please, if you are going to do activities, encourage physical distancing, and please do stuff outdoors. Outdoors is so much safer than a small confined indoor space. Medically vulnerable persons should try to avoid gathering with unvaccinated folks. Folks, even if you are vaccinated, if you're around a lot of unvaccinated folks, you're increasing your risk of being around someone with a very high viral load, getting yourself infected, and being one of those unlucky few who does get hurt even though you're vaccinated. If you're having a large public event, consider if you can rearrange it, if you can postpone it. If it's indoors, move it outdoors. If the weather's good, do things that we know help lower the risk. We have to go on with our lives, but we have to remember we're in the middle of a pandemic and our actions have a major impact. And the final thing is, please, we have gotten through this as well as we have. And let me just reassure you, it continues to be my impression that we have done very, very well as a state because we've had a sense of community. People across the whole state have come together and worked together. This week alone, I went to Mason, Robertson, Harrison, Bath, and Rowan counties. The governor and I and Rocky were in Rowan County last night visiting with the medical community that St. Clair brought together from 5 different counties. Folks came together on behalf of Kentucky. People put aside their other concerns to figure out what needed to be done and how could we work together. It continues to happen, and it really does happen, and I just want to assure you of that. So please, if you are a red county, and there are now 10 today, there were none on July 1st. I think there were none on July 1st. We now have 10 as of yesterday. Please take this seriously, and that last bullet is not the least important. It may be one of the most important. Please come together as a community. We need local leaders, local people who are respected by the people in their communities to message and demonstrate through their choices and actions that vaccines are important. It makes a big difference. It's what we do to keep ourselves safe. Thanks for all you've done, and we will get through this together. Thank you.
Thank you. All right, now one of my favorite parts, which is our Team Kentucky All-Stars, and we'll open it up to questions. Today I have the opportunity to honor a very special Kentuckian who made an impact on one of Kentucky's greatest treasures, the Red River Gorge. For 47 years, Don Figg called the gorge his office. His friends and colleagues said Don had a work ethic and caring spirit as large as the 29,000-acre canyon system in east central Kentucky. Don initially began working in law enforcement in the Stanton area, which led him into search and rescue. In 1962, he initiated the Red River Gorge search and rescue effort. He traveled across the United States to be trained at a variety of national forests, returning to the Commonwealth to apply his learnings at the gorge to keep all of us safe. He was on call day and night, regardless of weather conditions. During his career, this is incredible, he participated in around 1,660 rescues, a heroic number unlikely to ever be matched. Don developed a system of pulleys, ropes, and more unique to the gorge's topography, all of which are still used today. He received a presidential citation, a USDA Honors Award, a Congressional Award of Merit, and a Kentucky Senate Award of Merit. Sadly, Don passed away in 2020, another amazing person we've lost in the last year and a half. But his legacy and his impact live on through a dedicated team of search and rescue team members who continue to carry out his and their mission. The squad now has a first aid building, which they have dedicated in Don Figg's memory. Today I'm proud to pay tribute. Today I am proud to pay tribute to the Don Figg Memorial First Aid Station in memory of Don, a fearless Red River Gorge guardian. Joining us today, and I hope they'll come up for a minute for this special moment, is Lisa Johnson of the Powell County Search and Rescue Team, along with County Judge Executive James Anderson, Jr. I've known you a long time. I didn't know you were a junior. Lisa's taking today's acclamation to Don's wife, Susan, who is unable to attend.
Thank you.
Thank you for all that you do.
Thank you.
We appreciate you. Judge, we appreciate you. What a special legacy to start something and to create the processes that are still being used today. And an incredible number of rescues means a whole lot of people got to go home to their families. I look forward to also being present to cut that ribbon, to dedicate that facility. And thank you to the Search and Rescue Team for all you do. Judge, thanks for your leadership. Lisa, you may not know this, but each week when we highlight Kentucky All-Stars, Kentuckians making a difference for our people and Commonwealth, we decided to double up today. This week, we're proud to recognize you and the entire Powell County Search and Rescue Team for your continued efforts in serving the Gorge area. Each day you show up to ensure residents and the visitors of Powell County and the Gorge have access to the quickest and safest rescues when necessary. You and the entire team of volunteers show the true meaning of selflessness, something we have had to all learn and show during COVID, but also bravery and compassion. Thank you for what you continue to do. We appreciate you. All right. I think we had more than a few topics today. We are happy to open it up to questions. I know I have my list of people somewhere here, and if not, I know that somebody can grab it for me. But I tell you what, why don't we start and move this way and make sure we get everybody. Karen?
Governor, Dr. Stack touched on this. You had a chance to celebrate healthcare workers last night, and you got to talk one-on-one with a lot of them afterward. One, talk about that experience, and what concerns did they mention to you as the numbers go up and the Delta variant is more prevalent?
Well, I had the distinct honor, but really a pleasure, and I got a little emotional last night to speak to several hundred healthcare members, healthcare heroes that worked on all types of the front line in the greater Moorhead, Rowan County region, Flemingsburg, and others. It went from the healthcare groups in our schools to those in the ER. I got to meet the doctor that treated Rocky Stad, why he's still here, 85 years strong and young today. First, it was clear from each individual that they did feel Team Kentucky, the community, the coming together that it really took. I mean, we saw them walk into COVID units at times when we didn't have the best of the best PPE to protect them. And a lot of them thanked me, and admittedly, I didn't know how to take that because, I owe them, we owe them those thanks. They are concerned about the Delta variant, but they have confidence. They have confidence in the fact that we have come so far, and they also know that the solution is out there. I don't know if you saw last night, but they all had a badge that said COVID-19 vaccinated. And that, in the end, is what we need a little bit more. I also think it broke down if there were distinctions in many ways between doctors and nurses and those that process people when they came in sick. I mean, truly a feeling of teamwork that it took to make it happen. Bruce?
Thank you, Governor. How much of a threat does the Delta variant pose to economic recovery in the state? And is there a tipping point that would lead you to reimpose a mask mandate or capacity restrictions or any other actions?
The question is what threat does the Delta variant have on our economic, I wouldn't say recovery, I'd say resurgence or surge from where we are, because I believe it is very quickly going beyond where we were before. And is there a tipping point where we would consider some new decisions, restrictions, you pick? We're not going to be afraid to make the tough decision if it's merited. But it is important to note and explain, if we have to, that our world's entirely different post-December 15th when we got the first vaccines. I guess they came out of the factory on the 13th. And the fact now that people can protect themselves significantly from the Delta variant simply by getting a vaccine does change the equation. I will tell you what we are looking at now, or will be looking at, amongst other things, is hospitalizations, and then what the outcomes are and how sick individuals are. We'll also be looking at the breakthrough rate because, again, you have the option to protect yourself. I do not believe in the long run that this is going to stop our economic resurgence. It may change who gets to participate in it, because if you get sick and you stay sick for a long time, when really good jobs are being created, you may miss out on your opportunity to grab one of them. And so what I'd say is this is a chance for many people of a lifetime to have higher wages, to have new opportunities, and I'd hope they wouldn't miss it because they don't get the shot and ultimately get sick. Jack?
Governor, what are the 10 red counties and your recommendations for them, talking about possibly postponing public events? Would that include like athletic events, even church meetings?
Well, I think it's going to be incumbent on everybody to look at their own practices. And when you are in a red county, I think you want to look at the size of your event, what you already have in place. Are you skipping a row? What's the overall capacity? What's your ventilation? We've all done these things now. Whether or not you're wearing a mask, what the makeup of who's coming is, whether or not you can move it outside. When we had to do some of the things we did early on, we didn't have all the data all the information to know how it spread and how to stop it that we do now. So our goal here is to highlight the concern about what large events can do, because we've had clusters. Remember, we've had more clusters than any time since the vaccine was introduced, and make sure people have the information to either stop them or avoid them. I mean, we've got an event coming up, I think, in Red County. We're looking at moving it outdoors and reducing the capacity. Corinne.
What else can be done to encourage people to get vaccines in areas that have low vaccination rates? And are smaller rural hospitals prepared for surges or do they expect to see surges like they saw last year?
I'll start with the second question, which was, are rural hospitals prepared for a surge if we face one like we saw last year? I think the answer is we are better prepared for it than ever before. A couple of reasons. Number one, we know more about treating, even a more aggressive variant than we did in the beginning. But second, our hospitals have been talking to each other, because we've had to get through this in ways that I've never seen before. Regional approaches, open dialogue and communication. We had times where they had to talk about how many openings they had if one started to have too many. We have more. I mean, we're going to announce a new joint program here in a couple weeks between two hospitals. You've seen more of those all around. We've seen openings of new facilities. So, I believe that our hospitals are in as good of shape, if not better, than at any point in the pandemic. Now, we have other issues moving forward we've got to address. We have a huge nursing shortage. We have over 6,000 nursing positions open in Kentucky. You know what I would do to create 6,000 new jobs through an opportunity in Kentucky? Those are jobs that Kentuckians should have and that we should fill. But those are issues that existed before that we need to address. Remind me of the first one, because I took way too long on the second one.
What else can be done to encourage people to get vaccinated?
Yeah, what else can be done to encourage people to get vaccinated? First, if anybody has a really good answer to that at this point, I would love to have it. But I think in seriousness, where we are is with how risky the Delta variant is, we need every individual to make a few more efforts to talk to their friends and family. This is the point where even if you are in your 20s or 30s, you're at risk of losing a friend who, for whatever reason, will not get vaccinated. And that's what all the research is showing us at this point, that the folks that have held out to date want to hear it not from me, and not necessarily even from a community leader in their community, but from someone they know on a more personal level. The other thing, though, we're seeing is that people aren't actually calling and talking to their doctors about it. And I really hope they will. I mean, you trust them to do so much else. You go in to do your physical, and then everybody does about half what the doctor asked them to do. This is more serious than that. And I truly hope, if you haven't gotten vaccinated, please reach out and get more information. Please. And again, I know you're not going to take it from me at this point. Choose your doctor. Choose a friend who's vaccinated. I mean, I promise you, there's no microchips or any of that in this. This is a vaccine created by the Trump administration that has been administered in the Biden administration. I mean, there's no politics in this thing, and it works. Tom.
Thank you, Governor. Good afternoon to you, sir. I've got two. You mentioned the ARPA funds going to cities. With respect to the judge who's here, are counties sharing in that same kind of money? You didn't mention counties. That's my first one. And then the second one is the executive orders you have rescinded or let them all expire, except this week you extended the one on price gouging. Can
Right.
you give me the background on that?
So first, the county funds are coming. They don't have to flow through the same way that the city funds did. So that's more of a technicality. No, counties are getting significant funding that I think Judge would tell you we're really excited about, whether that's budgets that have been hit hard or necessary infrastructure that is out there. And then second one was? Executive order. Yes, we still do have an executive order on price gouging because we still do have a state of emergency. Just because we don't have restrictions in place doesn't mean COVID isn't an emergency. It absolutely is, and we have seen that there are people out there who will try to take advantage of emergencies in any way that they can. At least the last report we got from the AG's office were that they were still getting calls on it. If they were to communicate that we don't need it anymore, we'd look at that. But the problem is, if we take it away, what do people start doing? Because you don't have certain legal actions that you can take without it being in place. So there is a chicken and an egg concern with not having it in place. Carolina.
Do you have the age breakdown for the people who are getting COVID from that period from March 1st to July 21st? How old are they, the ones who are getting sick, the ones that are being hospitalized? And then also, I know the amount of people that have gotten COVID that have been fully vaccinated is much lower than the unvaccinated rate. But people are hearing about these increases and they're getting a little bit concerned about the Delta variant. What is your message to those who have been vaccinated and are a little bit concerned?
So we'll get you the numbers as they break down in the age groups. What I see every day are the incident rates, which means what are the hot spots, and they are always under 50 years old. They bounce around on the 3 or 4 categories underneath that. The 18 to 29 is always one of the higher incident rates, and then you see it being kids that are younger, or that group up to 49 being the other. But I will tell you, I don't remember the last day that 65 and up, or even 50 and up, given that they are over 60% or over 80% vaccinated wherever. They're normally half of the incident rates at best of the other groups. So what I tell vaccinated people is, it works. This is one of the greatest vaccines ever created. Any of them are at this point. They provide you very serious protection from getting even the Delta variant. But if you get the Delta variant, they provide you significant protection from getting really sick or dying. And when you think about a lot of other vaccines we take, that's the overall object of so many of those. But with the Delta variant out there, listen, if you're nervous, I get it. Take the steps you feel like you need. If you want to put the mask back on going into the grocery store, go ahead. Go ahead. And I want to encourage people to take that into their own hands. Any extra steps that somebody takes can't hurt and don't hurt. And we will see where this goes pretty quickly. And we're going to see how it grows, and then hopefully how it diminishes. And we're going to continue to communicate regularly, so that if the risk grows, that we're going to let people know. But my overall message to people who've gotten vaccinated is thank you. Convince your friend who hasn't gotten vaccinated. That'll protect all of us better. Mark.
Taking into consideration the Boone Circuit Court decision and the Appeals Court and the Supreme Court's decision not to do an emergency stay, and of course the Supreme Court hearings from earlier in June, do you believe you have the legal authority right now to reinstate a mask mandate and other COVID restrictions, and why or why not?
Well, yes, I believe I have the legal authority to do what's necessary to combat COVID. And that's because the last Supreme Court decision on point says that I do. And this is what executive powers in emergency are for. Now, we don't have a stay of some orders that have come since, because we don't have anything in place that it would be stayed. I mean, they would be staying an injunction that applies to nothing at the moment. So it's hard to read in. You got 6 or 7 different cases that are moving, and they're going to be up in front of the Supreme Court, hopefully to be decided altogether. But let's remember what would have happened and what would happen moving forward if the executive branch didn't have the power and ultimately the courage to do what's necessary. We see some in other branches that say it's theirs, saying they might recommend that people wear a mask. If you look back in time, what that would have done is South Dakota. Where at one point was the most dangerous place on earth to be if you were going to contract COVID.
The attorney in that Boone Circuit case says that if you do reinstate any of that stuff, he's going to try to have you held in contempt. Do you think that's...
You mean the attorney who has sued me like 3 dozen times is going to say he's going to sue me again? Yeah, I'm not going to lose any sleep over that. So, Lawrence and then Al.
A couple of questions. First, a clarification. Are you saying you're not ruling out mask mandates or other mandates if you think the science reveals that it's necessary?
Oh, if I think we have to take steps to save lives, we're going to do them. We're going to do them. We've had the courage to do what's necessary to date. But I want to make sure I'm clear that the world is very different, though, now as opposed to what it was before. And so our decision calculus would be very different. Certainly the threshold for taking an action when all you got to do is go out and get a shot certainly changes things.
Second part of that.
Sure.
Will any new recommendations be coming from the Department of Education regarding schools in the fall?
We're going to be talking with KDE later this week. I think there are some difficult questions we have to address. But let's make sure that everybody can step back and realize some basic facts about it. If you want your kids in class every day of the next school year, there can't be COVID outbreaks in the class. And how many kids in a class are vaccinated or protected in some other way depends on how many days your kids will miss because they'll have to be quarantined. That's nothing shocking. That's exactly how it's worked, and that's exactly how the quarantine rules work. And I see a whole lot of people gearing up because they want to have some fight about this. But the basic facts are, if you want your kids to be in school every day of the next year, the only way to make sure that happens is to get them vaccinated or to make sure that there are other protections in place. You know, we showed that the thing about a sports team, which we were talking about before because it was a little earlier, the difference between being 80% vaccinated and 20% vaccinated is you play as opposed to you forfeit because you don't have enough players with the quarantine. That same in a classroom, same on a factory floor. Al.
My question just became a two-part question
Okay.
because of your answer to that question. The governor of North Carolina has said kids in K through 8 are going to have to be masked. Are you considering that sort of step?
We will have to look at and answer that question, but I'm still, we're going to have conversations with KDE.
Okay. And my original question is that I want your thoughts about what the American Hospital Association said today, that it stands behind its members who require their employees to be vaccinated. And a big AP story about problems in nursing homes with transmission of the virus. You said you're not going to mandate vaccines by anybody, but isn't there some way, perhaps through incentives, that we could get more of these nursing home and healthcare workers vaccinated?
You know, that's an interesting question about whether or not there are incentives for more vaccinations amongst nursing home and other healthcare entities. And let us think about that. Let me be very definitive, though, that I support any hospital system that wants to mandate vaccinations. That is their choice as an employer, especially with folks doing what they do. I support groups like Atria that required it in the long-term care. So certainly any private entity that steps up and sees that as necessary, we're going to be behind. We have seen employers offer incentives to different degrees of success. If there is that idea out there that has a higher rate than what we've seen in the private sector, it's certainly something that we would consider.
Specifically, I'm thinking about ARPA money.
Well, I believe, so we get ARPA money in two tranches. We got the first, 1.1, and we'll get the second 1.1 next year. So with the legislature, we'll be talking about that. My recommendation will include essential worker bonuses, and that'll be a nuanced question we'll have to answer in that. Sarah?
Yeah, so this might be for Dr. Stack, I'm not sure.
Oh, I'm good with that.
So we have a lot of new guidance, and a lot of it is for adults, vaccine-eligible children, and so forth, but I have a scenario kind of outside of that. I heard from a reader who has a 7-week-old baby. Now, the father and the mother are both fully vaccinated.
Yeah.
But the kid obviously can't mask. She's gonna touch her face and stuff like that. So he was wondering, should they just never have the baby around anybody? What should they do to protect the baby besides what they've already done, which is get vaccinated?
I think that is a question for the doctor.
So the question was about a family that is a 7-week-old baby who can't get vaccinated and won't be able to for quite a while. And so should they keep the child, the newborn, away from anyone else? And the answer to that's no. They need their bonding time and their exposure to others. That's fundamental, particularly at that age. And again, I hope I've been consistent through this journey. There is no free lunch. Life is full of risks. We make choices. There's relative risks. For all of us who can get vaccinated, hands down, there's no doubt, there's no debate. There's no debate among anyone who looks at science and facts seriously. The vaccines work. They protect you. And if you couple that with some other simple steps, if you're vulnerable, like wear a mask, wash your hands, keep some distance, you can go out in the world and enjoy your life again, not like we were last year. The kids, it's not that COVID can't be bad, and the governor shared examples, and there are some kids who do get hit hard by it for various reasons. But the statistics overwhelmingly are that kids are at lower risk than the adults. So every household with someone 12 and older would ideally have everyone 12 and over vaccinated. And you know what? That 7-week-old's not going to get exposed to too many people with COVID because the disease will start to dry up and go away. So if we all get vaccinated, that's how that 7-week-old doesn't have to worry about this.
Sarah, I don't have a 7-year-old, but I have an 11-year-old who is living in a household where all the rest of us are vaccinated. And by the way, she doesn't think it's fair, and neither do I. And certainly, we're not cutting her off from the world. However, she is wearing a mask in certain situations, and we're going to continue to do that. Who else do we have? I saw we have Joe.
Might be the last one. So I have two questions. So the first one about vaccinated population, or the unvaccinated population rather. How concerned are you that this group of people has effectively tuned you out, tuned out the voices of pretty much anybody who's calling for people to get vaccinated?
They haven't tuned me out because they're commenting on Facebook right now.
How concerned are you that they're not listening to the message then about vaccinations and about the concerns over the Delta variant, the rise in cases? And then the second one is a question about unemployment. How do you feel like there's enough being done to deal with the unresolved claims and what could be done? Because I know we're still hearing a lot of people deal with that.
So on the unemployment side, we do expect to have an RFP out this summer, hopefully sooner rather than later. While I wished it had been out before, the entire game changed with the level and sophistication of cyber attacks, we believe many of which come from foreign countries that want to see us fail at a level that no system in the United States was sufficient to withstand. We also don't see any system around the United States that could handle the flood of claims that came in. So we're asking somebody to build something, if not brand new, better than we've ever seen before, and we weren't going to get that. And certainly the price then changed in a way that was, it violated every part of procurement. So in the end, we decided we wanted to do it right instead of we wanted to do it fast. Long term, to fix unemployment, we also need more permanent people. And we didn't get that from the last General Assembly, but maybe we can from this one. We did get more temporary people. We continue to process claims. One update that I think we have seen is our individuals on pandemic unemployment have decreased by at least 7,000, a little over 7,000 in just less than the last month or so. And we're going to continue to work on processing claims. I think we are at a point where those that are unvaccinated aren't listening to any public official at this point about what will get them vaccinated. I think we've also seen data that they've tuned out local leaders and a number of others. And that's why I think it's really important for individuals, to the extent they can, knowing how dangerous this virus is, to encourage people to get vaccinated. If you take the reader that Sarah was talking about, if your friends are coming over and you got a 7-month-old that's not vaccinated, I am asking them if they're vaccinated, and that's going to change the way that I interact with them. And if they're not, I'm going to do what I can on a personal level to try to talk to them about it. I've had some of these conversations being a dad at a baseball game as opposed to being the governor, and they're different each time. But I think Dr. Stack said it last night. You can't be judgmental in the conversations. You got to have humility in that you're not trying to tell them that you know better, and we have to be patient. And that's really hard. That is really hard with where we are and with what I truly believe about these vaccines. We've had to be really good people in the midst of COVID, and we're going to have to be really good people as we continue to try to convince more and more and more to get vaccinated. Nobody has found the secret yet, and I don't think there's just one. I think these are really individual conversations, and that's why, while I wish we had a lot more people getting vaccinated each and every week, the fact that it seems steady, at least to a degree, I think is a good sign. All right, anybody that I missed, because we've gone about an hour? Nope. All right, thank you all very much.